in. First off, I'm Aaron Levo. I'm the Vice President of People, Culture, and Communications. Happy to play a moderating role, as always, for our town halls. And we're going to have a series of presentations today. I think we have 4 in total. And then there'll be an opportunity for participants in today's town hall to ask questions using the Q&A function at the bottom of your screen. But please use the Q&A function for your questions, and we'll keep the chat function clear for our celebrations. You can, of course, type them in as we go or reserve them to the end for that section in our agenda. We'll have the opportunity to give a shout out to our colleagues, to something that's happened in the organization, an accomplishment or what have you. So keep that in mind. And as you use the Q&A function to ask questions, the answers to your questions, our panelists will respond live where they can, and those answers will stack up in the answered tab within the Q&A function. And then if we don't have the right person to answer a question you've asked today, we'll make sure to get a response to you via email. So that's our process for that. And I think that's all the housekeeping out of the way, with the exception of saying our President CEO, Rob McIsaac, couldn't be here today with another commitment. Fortunately, though, we have Sharon Pearson, our Executive Vice President of Clinical and Chief Operating Officer and Chief Nursing Executive to carry us through the intro and our operational updates. So I'll pass it over to you, Sharon.
Great. Thank you, Aaron, and good morning, everyone. Happy to be here today and welcome everyone to our town hall. As always, I'd like to start by acknowledging that we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. There's several really important observances that I would like to call out today in a few opening remarks. First, I'd like to acknowledge that tomorrow, May the 5th, is the National Day of Awareness of Missing, Murdered, and Indigenous Women, Girls, and Two-Spirit People. Also, as many of us know it as the Red Dress Day. If you're interested to learn more, as we all should, about the significance behind Red Dress Day, please go to the Human Rights and Inclusion page, which, as you all know, is on the Hub. Also, earlier this week, on May the 1st, we recognized National Doctors Day. And I do hope you all took the time to acknowledge the physicians that you work alongside as colleagues at HHS. It's hard to believe there's 1,300 physicians distributed across our organization in a number of different roles and capacity. And certainly we are grateful to each and every one of them for choosing HHS and to practice here and share their skills and wisdom with ourselves and with our patients. So many thanks to all our physicians out there. It's not too late to wish them all a happy Doctor's Day. And then next week, more colleagues to celebrate. We'll have opportunity to celebrate National Nursing Week. And the theme this year is Our Nurses, Our Future. And we will be saluting the more than 4,000, hard to believe, 4,000 registered nurses and registered practical nurses that work across all of our organization. Certainly as a former nurse and the Chief Executive Nursing Assistant now, I know how demanding and challenging this role is. And thank you, a genuine actual thanks to all of you for the care you provide to our patients and to our families each and every day. There is a host of activities planned over the course of next week, including our annual Nursing Excellence Awards, which will be held on Thursday, May 11th. It will be at the Juravinski Hospital. There'll be a Zoom option as well, so do hope people can Zoom in and listen to the award ceremony and hear about the fabulous nominees and recipients of the awards this year. And if you could please also go to the Hub to look at the calendar of activities that are scheduled for Nurses Week as well. There's many observances and celebrations occurring. And then I also want to take a moment just to talk a little bit about the West Lincoln site. Hard to believe, but it's the 1-year anniversary, or it was last month, of the groundbreaking for the new hospital. And you can see the West Lincoln rising now, which is a wonderful site. We do have a committee that's been established, comprised of our staff and physicians. that is looking at how we will function in the new building, something we called operational readiness. And that's a milestone in and of itself to have this committee that we're actually talking about how we'll function in the new West Lincoln site. So a very exciting time, not only for the staff at West Lincoln and physicians, but for all of HHS. And I know the community is extremely excited about this new build. And then before I transition to the regular operational update, I just want to extend a genuine thanks on behalf of myself and certainly the executive team for all of the work that is done every day across HHS. We are extremely grateful, and it is an unrelenting pace, I know, as the whole world comes out of COVID. So we do thank you for all your efforts and what you do provide daily to our patients. I would like to extend a reminder that it is important to take care of your health and well-being, and certainly the Employee Assistance Program is available at all times if you should ever need any extra support. And again, that information is also available on our hub. And with that, I will transition from welcome over to my regular operational update. So if we could just go to the next slide, and you'll note these numbers just get smaller and smaller. So our COVID patients are down to 29. We have less than 5 patients in our ICU, and happy to report we have no outbreaks at this time. So wonderful news as we see the decline in those numbers. And the next slide, from a capacity perspective, we do feel some of those pressures relenting just a little bit. And I'm sure many of you can feel that in your respective areas if you work in the front lines. But certainly we continue to see some extended pressures at the JHCC and lots of strategies underway to mitigate those pressures. But considering we're seeing highs of 120 and 122%, certainly seeing some occupancy numbers in the 90s is quite welcome. And I'll talk about ALC, but you can see we're actually below 200, which is, again, certainly making the sites flow much better. Next slide. From a capacity, while we feel that relief and occupancy, it is still higher than we would like to operate in order to flow patients in a more sort of relaxed pace, I would say. So we have 70 unfunded beds open daily at any given time across our organization to manage our capacity. And certainly that does require us to care for patients in unconventional spaces, which is not what we desire to do. So lots of work to reduce that occupancy and reduce that reliance we have on our unfunded beds. Concurrent activity on trying to get to our pre-COVID surgical activity. So right now we're about 80 to 90% of our pre-COVID activity. We hope to be fully back by the fall. Efforts underway to stabilize and increase that activity is the opening of the additional OR at the Hamilton General Hospital. Lots of work underway to stabilize our anesthesia and perfusion services, which are critical to our operative services. Opening of the same day overnight surgical unit at the McMaster site just recently in April, and certainly ongoing recruitment efforts for our perioperative nursing along with other staff. So lots of work underway to address the gaps we still have in surgical activity. And the next slide, please. I just wanted to call out where we're at in terms of our emergency rooms and our visits. So you can see we're relatively flat other than the yellow line, which is the McMaster site. So we do see some seasonal variability at McMaster, which is not atypical, but otherwise the other 3 sites remain much like our pre-COVID activity at this point. And you will see in the bottom Pareto the decline that we're seeing in our ALC volumes, which is greatly appreciated and much due to the work of the clinical teams and certainly our discharge planning teams as well. Next slide, please. In terms of other operational highlights, just a note that we are fully funded for our satellite health facility. Reminder, that's our 120 beds that we have. And we do have funding continued to 2024. So that's excellent news. Lots of work underway to stabilize our burn program and great efforts from Dr. Mark Jeske and certainly the clinical team to really stabilize our very important burn program. And then I just wanted to call out our ambulance offload improvements on the next slide. And the visual is certainly you can see the work that's been underway from the team. So the darker line is the Hamilton General. And certainly we've seen a reduction from our peak times of over 200 to down to 133 to 184 minutes. Lots of work happening at the Hamilton General. And the biggest change, the largest change we've seen at the Juravinski site, the lighter blue line, and you can see we had a considerable peak at 247 minutes. We've actually reached a low of 25 minutes at that site. And I cannot but call out all of the work of the team to certainly make those improvements at the site. We did have an additional infusion of capacity to help that, but lots of process improvements coupled to make a very monumental change for our patients and reducing that time to care. So wanted to call that out. And with that, I'm going to hand it back to Aaron for the rest of the agenda.
Yeah, thanks very much, Sharon. Informative update today. Next up on our agenda today, we have some information for everybody about one of the programs of work arising out of our workforce planning initiative. So you'll recall our workforce planning initiative is within our strategic plan, a very important transformation initiative intended in many ways to address the workforce pressures that we are seeing around our entire organization, with a specific near-term emphasis on the instability we find in many of our clinical units and services. And one of the programs of work, there are 5 programs of work, and we've been striving to bring each of those forward to everyone at Town Hall. And the one that's going to be presented today is about management support, which is being led by 2 of our directors, Pam Westover and Amy Williams. And Pam and Amy are going to talk a little bit about the early framing for that area of work within the initiative. So I will turn it over to them to take it away.
Thank you, Aaron. So next slide, please. So HHS strategic plan has progressed through a series of projects and initiatives, and our transformation program has 4 initiatives that represent the most pressing challenges we face as an organization. One of these initiatives is workforce planning. The short-term goal for workforce planning is really to identify and prioritize efforts that will stabilize the most critical staffing gaps that we experience that impact our clinical services. Next slide. So there are 5 programs of work that have been identified to address workforce stability, and these programs do work together to identify strategies impacting recruitment, retention, data analytics, models of care, and support for managers. And the focus today is to share with you an overview of the management support program work. Next slide, please. So we know that managers do play a key role in enabling success of our clinical and our non-clinical programs and our units. And back in February at the quarterly meeting of HHS formal leaders had an opportunity to provide input into the 5 programs of work, including management support. So what did we hear? A number of themes did arise and were identified that impact the clinical manager and manager roles with regards to workload and capacity. So looking at those themes, there was identified significant administrative burden associated with staffing and scheduling, patient flow processes, the volumes of meetings, and inconsistency in the access to support for task delegation, such as admin assistant roles, access to educators, and opportunities were identified that would be helpful to standardize common processes, recruitment, onboarding of new staff, reporting, and information accessibility. And I think what also really was evident that there was a lack of capacity for the managers to take on corporate project work or any special projects or initiatives that were of interest to them. So I'm going to hand over now to Amy to talk more about our program.
Thanks, Pam. So the focus of the workforce planning is to stabilize clinical areas experiencing the most significant staffing pressures. The management support program will identify strategies that impact the clinical manager role related to the non-clinical areas, with the goal of enabling the clinical managers to focus more on leading their units and their teams. So this is in alignment with the outcomes for the workforce planning initiative. Next slide, please. As we work towards these outcomes, a process is underway to collect more information from the clinical managers to better understand their administrative tasks, challenges they're experiencing, supports available to them, and what additional supports will benefit their roles. We're already receiving some helpful feedback from managers and look forward to receiving further comments to incorporate into this work. Once these interviews have been wrapped up, responses will be themed to identify common areas to explore. Responses will be shared with the leads of the other workforce planning programs and the steering committee. So this is some relevant information can be also incorporated into their work.
Amy, I'm
Yes,
so sorry to interrupt you mid-stride. I know you're trying. I can tell you're leaning into your mic. If you can lean it just a little further, it's a tiny bit garbled, and I know that's so hard to do, but I just thought I'd ask to see if we can get a little more clarity.
sorry. I'll just keep going and hopefully people can reach out to me if they haven't heard anything more information.
Perfect. It sounds better already. Thank you.
Okay. An expression of interest will be coming to clinical managers to help design the strategies that are resulting from these initiatives. So one way to support, next slide, please. So one way to support this work for clinical managers is to provide feedback through the interviews that are currently underway. You can ask your director for more information or to reach out to either Pam or myself. The management support work will be involving the managers with the design strategies to address these key opportunities. If you're interested in participating, look out for more information that will be coming, either reach out to Pam and myself as well. Thank you. Sorry for the audio problems.
No problem. It happens. And it was pretty clear at the end. So thank you for trying and for the update today. Some really important work that you and Pam are helping to lead for all of us. And I know that people will reach out to you if they wanted clarity, or maybe they wanted to ask a question. So our appreciation to both of you for that today. Next up, we have Dr. Rob Lloyd, who is our Chief Medical Information Officer, to give us an update on an upgrade, Epic upgrade, June 7th. Rob, what do we need to know?
Thanks, Aaron. So I'm just going to spend a few minutes talking about this today. For the most part, it shouldn't have much of an impact on us on June the 2nd because it's happening in the middle of the night. Mostly what we're going to experience is some good stuff to come afterwards. So I want to talk to you a little bit about what's coming. Upgrades and updates to systems are really important. Just like when you update your phone or your laptop for key security updates and improvements, we have to do the same with Epic to keep it fresh. Improvements to an upgrades to an EHR like this are big and complex. They're a big lift. Epic is recommending that we do this every 6 months. And so from here on in, we'll be doing that. But this is our first upgrade since go live about a year ago. And it's essentially a triple upgrade. It'll move us to a new version of the system and deliver a whole bunch of improvements. But we have to be prepared for it. So next slide, please. Here's a few of the key cool things that are coming. This is just a taste. Book It is replacing Make an Appointment. So this is probably the biggest change, and it's really a complete change in the way that our booking clerks, that you folks are doing that work. It's a flatter, more efficient experience, and I think most are looking forward to it. There's an LMS video and learning opportunity for those who have started. We've had about 300 staff start this already, and the feedback is really quite positive. In the upper right, the brain for nurses is improving. It's becoming more condensed, more patients viewed on the screen, and a little bit easier to use. Bottom left, for providers, handoff is coming to Haiku. We no longer need to use Hyperspace. You can use handoff on the fly. And there's a few other features that should reduce our necessity to print it off, like reminders and follow-ups are right there. And this is going to be the same on iOS and Android, and Canto as well for iPad is being improved. And then bottom right, for those that see patients in groups, our ability to document on those sessions is improving, where you can document on multiple patients at the same time, and many caregivers can document on the same session. So that's just a taste. There's a lot of other things coming that you'll get to know as post June 2nd. Next slide, please. So what's actually happening? The real date, the downtime is June the 2nd, but leading up to that, on May the 9th, all the rovers will begin to be updated. So there's no actually downtime for this, but when you pick up your rover after 4 o'clock on May the 9th, you'll be triggered to do an update. So we'll ask you to allow that upgrade to happen. If any rover devices that aren't upgraded before June the 2nd are going to have some challenges. So please make sure that you allow that to happen. On May the 12th, the training platforms are going to be down for most of the day. This won't affect most of us unless it will affect our training teams though, and there's no classes happening that day. We're just to emphasize, we have a freeze period in place from the middle of May through to June the 9th. And this is to prevent changes in the system and allow the upgrade to go smoothly. So we'll ask for your patience with some of the optimization and fixes that you've asked us for. We'll be stalling those for or deferring those for the next couple of weeks, starting May 15th. And then the actual time is June 2nd. So if we can go to the next slide. So as I said, rover starts at 4 p.m. on May the 9th, no downtime needed. The next one on May the 12th will be the time down for the training environments, but our big time is June the 2nd. So this is all platforms down. Hyperspace, Rover, Haiku, Canto, and MyChart will all be down for 2 hours between 12:30 and 2:30. So this is Thursday night, Friday morning, early Friday morning, 12:30 to 2:30. We've done downtimes twice now in the past, since go live, one in November and one just recently in April, and they've gone off pretty smoothly. So we're not really expecting any problems. Because it's a big upgrade though, technically we have our staff on call, really sort of a mini virtual command center set up for the day or two post go live in case there's any significant issues. Not really expecting anything, no. Next slide, please. And so what we're asking you to do to prepare is those of you that are working that night and staff and managers and directors, please ensure that the business continuity device, that's the computer that's in every nursing station and every clinical area that has backup electronics on it. Make sure that those are, you know where they are, that the hardware is powered on, and review the BCA reports and test print. There's specifics about this on the hub, but we'd like everybody to be prepared. And specifically for the downtime itself, for clinical folks, maybe a couple of notes. It's a 2-hour downtime. For providers, doctors, we're suggesting, and we always do suggest, that if there's anything critical, that you go ahead and order that on paper using the paper downtime procedures. If they're not critical, we suggest you hold your orders until after the downtime and the system comes back up. Same thing for nursing, for documentation, and for all of our staff. Some documents, if you want to document on paper and it's critical, you can scan it in later, but we suggest you back enter it afterwards. Once the system comes up, it comes up in stages. Admissions has to happen first, and some other key factors before documentation and orders. And then the orders that were enacted during the downtime will be back entered as telephone or verbal orders by nursing staff. And then key things by physicians that need to be entered are then back entered, such as admission orders and so on. So have a look at the hub, please. Update yourself, remind yourself of how all of it works, and ensure that you're ready for it. Next slide. So if you've got any other questions, we also have our on-call team, and look to the hub for any questions, and send us emails if you're concerned. And that's it for me, Aaron.
Awesome. Thanks very much, Rob. And I'll just point out, I think there is a question when you have a minute in the Q&A now that you're done presenting. And thank you for that update today. So just encourage as well, any of our viewing audience that did have a question about content today, or perhaps something else, you can certainly enter it into the Q&A until the end of the town hall, and we'll do our best to have one of the panelists responds to your question. And I think as of now, that's all of our presentations. So we'll move on to our celebrations portion of the agenda. Sharon, I see you've come on camera. Do you have something to celebrate today?
Yeah, thanks, Aaron. I'd like to kick off the celebrations with an acknowledgement of one of our own executive team who's celebrating the 35-year milestone at HHS. So with 35 years, I think many of you may know Leslie Gillies and may have crossed paths with Leslie in the variety of roles that she's had at Hamilton Health Sciences. So just wanted to call out Leslie and thank her very much for her dedicated service over 3 decades plus 5 years. So thanks to Leslie.
Amazing. Thank you. I see. So just to remind our audience, there's 2 ways you can give a celebration. You can raise your hand as an attendee or a panelist, and I will call upon you, or you can type it in the chat forum. I have 2 hands raised. I'll go first in order of hands raised. I'll go to Dr. Allison Fox-Robichaud, who's one of our attendees today. Allison, you're going to get a prompt to unmute, and then you can go ahead and ask or give your shout out. So go ahead.
Thanks, Aaron. I'd love to give a shout out to Kelly Campbell and the entire Capital team for all of the renovations that they've done to the resident call rooms. We're in midst of the McMaster Children's Hospital ones, and I hear they're going great. So thanks again to Kelly, the team, and everybody else who's getting us ready for postgraduate accreditation and undergraduate accreditation next week.
Awesome. Thank you for that. Okay, next up, I have Leslie Goche. Leslie, please go ahead.
My apologies. Good morning. Sharon acknowledged the work that's happening in the operating rooms with our perfusion team and how critical they are to supporting our cardiac surgical activity and our ECMO patients. And I just wanted to make a special call out that it's Perfusion Week and acknowledge those colleagues for everything they have done throughout the pandemic and they're continuing to do to support our patients.
Awesome. Thank you very much, Leslie. I see Yelena Potts. You have your hand up. Yelena, go ahead.
I would like to recognize our Medity physiotherapists and our advanced practice physiotherapists during May, which is National Physiotherapy Month. And similarly, we have coming up on May the 19th, Personal Support Worker Day. And we have embraced many personal support workers working in our healthcare aid roles through our work. So recognizing their important contribution to our team as well.
Great. Thanks, Yelena. And I see also, well, here, actually, I'm just going to read one before I keep going on our list. I have Deborah Bings, who would like to give a shout out to the skin, wound, and ostomy clinicians for all their hard work and excellence in patient care and for their support of the pressure injury prevention in-year objective. So thanks very much, Deborah, for calling that out. Next up, I have Leslie Gillies. Leslie, what would you like to celebrate today?
Thanks, Aaron. I just want to celebrate learning in person again. I think it's everyone is very appreciative of the recent back to in-person educational sessions, nursing orientation, health professional orientation, charge role orientation. Thank you to our organizers, interprofessional development, clinical practice and education, and organizational development. I had the pleasure of meeting with all of our esteemed charge leaders this week on Tuesday. So appreciative of everyone's hard work and leadership. So just wanted to recognize that we're all happy to be meeting each other in person again.
Awesome. Thanks very much. Bruce Squires, you've got a hand up. What would you like to celebrate today?
Thanks very much, Aaron. So this is Mental Health Week, and so that's an opportunity, I think, for all of us as individuals to reflect on the importance of healthy mental health. It's also an opportunity to celebrate and thank everyone across HHS who provide mental health care. And I think people may not be aware that McMaster Children's Hospital is one of the largest providers in the country of childhood and adolescent mental health support and care, including having Ontario's largest child and youth mental health inpatient unit. We're a very important provider at a time, as folks are aware, where never before have we seen the volume, the acuity, and the complexity across the child and youth population. This is also Child and Youth Worker Counselor Week. So our CYWs, CYCs, and so I want to take the opportunity to particularly call out and thank that group of over 50 individuals who are such a key component, the front line to the delivery of mental health care to children and youth in our community and our region. Thanks.
Thanks, Bruce. And I see Susan Pucciarelli with a hand up. Susan, I have a feeling you're going to scoop my celebration too, because, but let's just hear.
I'll let you do that, Aaron. I just wanted to do a quick shout out to Natalie Plazzini. Many of you may know Natalie. She has been doing a temporary backfill as our Healthy Workplace Coordinator for Melissa Cummings, who will be returning from mat leave in June. And happy to announce that Natalie has taken on a permanent position as Healthy Workplace Coordinator. So we will have now Natalie and Melissa come June. So great to see Natalie be able to transition into that permanent role.
Yeah, thanks for calling that out. And maybe I could conclude just by acknowledging that it is also Safety and Health Week across our organization. And that's a week dedicated to recognizing and thanking our safety and health and safety professionals. I know as well, yesterday was in fact National Occupational Health and Safety Professionals Day. And that day acknowledges the education and the experience that it takes to advise and support, help all of our entire workforce to stay safe and healthy. So to our safety and ergonomics team, you're a really vital part of HHS, and your professionalism and commitments really appreciated. Thanks to each and every one of you for all the work that you're doing every day to keep us healthy and safe. And I think that is all of the, let me just check our chat. We have a couple here I want to make sure I read. One from Erica Casperson. Shout outs to all of our hardworking safety, security, and ergonomic specialists, as yesterday was Occupational Health and Safety Professionals Day. One from Marita Tonkin, adding to our busy May celebration month, already shared many of our health professional team members, physiotherapy, nursing, child and youth workers, and perfusionists. Also highlighting May as Speech and Hearing Month, with our speech language pathologists, audiologists, and communicative disorders assistants, such key members of many patient care teams across HHS. Thanks, Marita. What a fulsome shout out. That's awesome. From Tim Dodd, a shout out to paramedics. Paramedic Week is May 21st to 27th of this year. The theme for this year's Paramedic Week is diversity in paramedicine, the patient, the provider, the profession. So lots to celebrate for the month of May as we start to think about spring and all of those professions in our organization that help to keep us running. I'll leave it there, and maybe Sharon, just turn it over to you for closing thoughts. See you all next time.
Great, thanks, Aaron, and thanks for everybody for making those really important shout outs. Obviously a jam-packed celebratory month in May, and really important that we recognize the contributions of the collective for everyone at HHS. And I just to add one more, I wouldn't want to miss, because this critical group of admitted assistants across our organization in a variety of roles, they do keep our place humming. So a shout out to those individuals again. Want to thank everybody for joining us today. Really appreciate that you take the time to tune in and listen. We'll be back in June for the next town hall. So we will see you then. And I hope you all have a great rest of the day. Thank you.